Indonesia has various cultures from its local ethnics. Each region has its different characteristics. Madiun is a city located in East Java. Its motto as Kota Gadis, Perdagangan, Pendidikan, dan Perindustrian. Indonesia has various cultures from its local role to develop the quality of education, both nationally and internationally. Universitas PGRI Madiun Unikma has achieved some award, winning the awards of Top University Aku from Kompetisi 7, getting institution accreditation B, winning national competition grants, and many more. Unikma has 2 postgraduate programs and 4 faculties for undergraduate program with 22 departments. Postgraduate program, Indonesian language and literature education and social science education. Undergraduate programs, Faculty of Teacher Training and Education, Faculty of Health Sciences and Science, Faculty of Engineering, and Faculty of Economics and Business. To support students' activities and develop students' talents and creativities, there are also some students' activity centers: choir, band, theater, modern and traditional dance, karate, student regiment, and scout. In encouraging the smart and competitive alumni, Unikma also provides representative facilities, convenient classrooms, Campus 1, Campus 2, Campus 3, library, laboratories, micro-teaching and computer, sports center, language and culture center, Graha Cendekia, dormitory, gamelan room. Universitas PGRI Madiun Unikma commits to give learning-oriented education and student independence to develop their abilities and skills by organizing some activities such as national and international seminars.
Universitas PGRI Madiun and Kompetisi.
Unikma, smart and competitive.
Hi, welcome. This is us, Universitas PGRI Madiun, Unikma, and this is all about us.
Unikma is a private college located in East Java, Madiun City to be precise. In relation to the college vision and mission, Unikma highly commits to produce generations who are eminent not only at the national level but also international level, so that they are genuinely ready to compete globally. In case of which, Unikma responsibly supports the students by actively holding several international programs. These programs are Joint International Conference and Seminar. This is an active agenda held by the institution which can be used at creating an extensive network of contact. Besides, it also can be used to be active in research and meet researchers from all over the world.
ICTEX is an international conference on education and technology held by UNIPMA. It is held annually by UNIPMA to bring about development in education and technology all together among educators and also practitioners. Papers and articles presented in this conference are published in reputable proceeding publication and also trusted UNIPMA journal. And any institutions, whether it is domestic and also abroad, can be the co-host of this conference so as to develop together.
Signature. This program provides an opportunity to enrich the students inside about the global world. In addition, this program could be the students' medium to hone their English and teaching skill as well. CityFed program allows students to practically learn how to compete globally in college abroad. This program provides not mere theory, but more about proper ways to directly hone the students' soft skill in case of the work field. ICT. It is a program that can be beneficial for students who are willing to learn more about global matters in college abroad. Students are given chances to learn and encapsulate all the global knowledge from as many sources they could may or get, and the final results will be acknowledged in the credits.
My name is Adriansyah. I'm English department student at Universitas PGRI Madiun. I have participated in International Credit Transfer Program or ICT at Ilocos Polytechnic State College, Philippines. This program gives a chance for the students to take credit in foreign universities. In addition, students are able to increase their knowledge and skills, introduce Indonesian culture, and learn many things. So, don't miss any chance to study at UNIPMA.
IISMA. This program facilitates students to grasp knowledge and skill, exchange their insight and culture, building networking as well with the international people in the top 100 world university.
Being an awardee of the Indonesian International Student Mobility Awards has granted me the opportunity to study at Nanyang Technological University, Singapore. Universitas PGRI Madiun has given me an infinite amount of support, help, and also encouragement that leads me to become an awardee of this program. From this program, I get to understand more about how business marketing works, learn to function effectively in a culturally diverse environment, and also prepare myself to be the future leader of the 21st century. I also get to meet a lot of new people, visit Singapore landmarks, and enrich my cultural understanding.
BIPA. This program is a program for learning Indonesian language skill, speaking, writing, reading, and listening for foreign speakers.
UNIPMA joined BIPA in 2017. During that period, there are not much activities to do because of pandemic COVID-19. The program of BIPA is as follows. Number 1 is Dharma Siswa Scholarship. Number 2 is the language class, promoting 2 partner universities in Thailand, Philippines, and Malaysia. Number 3 is competitions. Of course, it is language competitions. During I'm charged in BIPA, I have an interesting experience. I taught language for my students. I also taught culture for them. But I also studied from them the language and the culture. That is very challenging and interesting. Thank you. UNIPMA, smart and competitive.
Faculty exchange. This program offers such great opportunity for lecturer to gain new experience in teaching abroad.
Together, our heart stays local, but our mind goes global. For Indonesia, for our world.
Okay, we will start the event. Good afternoon and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Waalaikumsalam warahmatullahi wabarakatuh.
Today is a special day because we can meet again in a guest lecture on molecular biology. In the next 2 hours, we will be lecturing and discussing with our speaker today, Dr. Denny Adriansyah, Orthopaedic and Traumatology Specialist from Dr. Suwardi Hospital. As you know, this activity is part of the program Kompetisi Kampus Merdeka Biology Education Department 2022. This semester we have 7 teaching practitioners from various professions who fill 2 until 5 meetings in each class, including animal ecology, animal embryology, animal diversity, plant diversity, applied biology, and today is the second time in molecular biology class. I think this opportunity is a great opportunity for all of you. So I hope you can listen and have a good discussion so that it brings optimal benefits. Thank you very much to Dr. Denny Adriansyah. Despite his busy schedule, he still makes time to be with us today. So once again, thank you very much. I think all the students here cannot wait to listen to Dr. Denny lecture. So Dr. Denny, time is yours.
Okay, thank you, Mr. Rom. Before I start the lecture, is my sound clear, or maybe
Very
still
clear.
okay? Thank you. Okay, I will start the screen sharing. Oh, the host is still disabling my screen sharing.
Oh, this way.
Yeah.
It's done.
Okay, thank you. Oh, still cannot
Still
screen
disabled?
share.
Okay.
Yeah, actually I'm using two devices here, my laptop and my cell phone. Maybe my laptop still. Yeah.
Please wait for a moment. It's done.
Okay. Okay, thank you. Yes. Yeah. Okay. Yeah, all of you may see the slide that I share. Okay. Okay, thank you very much for the introduction, Ms. Nurul, and to all the students. My name is Denny Adriansyah. I'm an orthopedic surgeon in orthopedic Muwardi, Rumah Sakit Muwardi, in orthopedic and traumatologic department. And today I will continue our previous lecture about the stem cell and cell-based therapy application in medicine, part 2. So as a recap, maybe about 2 weeks ago, so I'm going to recap recapping some of the lecture before that we already learned about the mesenchymal stem cell basic science, the cellular basic science, that the mesenchymal stem cell is a medicinal signaling cell. That which means that the mesenchymal stem cell that applied it to the body, that we apply to the body, we inject it to the body, acts as a signaling, not become the new tissue, not become a new cell, but a new paradigm said that the mesenchymal stem cell release the cytokine, release the growth factor that influence the resident stem cell, the stem cell that inside the body to produce and to replicate and to repair the damage or the injury inside the organ, the specific organ. And then we also learn about the conditioned medium, that the mesenchymal stem cell, that if we culture the mesenchymal stem cell in the media, and then we condition the media, such as we did the hypoxia condition, or we make the cell fasting condition, so or low glucose condition. So the stem cell that we culture, that will cultivate, produce some of molecule, some secretome in the conditioned media, that we call it a secretome. Yeah, the secretomes, it contains the growth factor, an important cytokine, and etc. And the secretome and the conditioned media, if we apply it to the site of the injury of an organ, such a previous research in animal, in human, it make the cell, the organ repair. And then also not only the conditioned medium, but the extravesical. The extravesical also, we have learned that the extravesical is divided into three types, yeah: apoptotic body, microvesicle, exosome, and the main function of exosome is intracellular communication. Yeah, maybe such as the secretome, but the secretome is a general, it's a general term for the exosome, microvesicle, that inside the conditioned media. And then also we learned about the tissue engineering, that how we apply, how we distribute the stem cell, the secretome, the cell-based product into the human body. Maybe we can add some scaffold, we add some biomaterials, and then yeah, such as skin graft, yeah, and supplement, and then etc. That make it will enhance the potential of the secretome, that may repair the injury, the site of injury of the human body. And then here we also have learned about how we in Indonesia especially applied the mesenchymal stem cell, the cell-based therapy, into the orthopedic cases, such as tuberculosis of the spine, and then osteofibrous dysplasia. We can see here the crooked tibia here, that we make a reconstruction, and then bone defect, and after that the bone is still straight again. And in infection, yeah, we can treat the infection using mesenchymal stem cell also, and it have been reported, and in the case report in Indonesia also, that the patient have been cured. We can see here the patient can walk without any assisting device. Okay, now we will progress to the conditioned media in orthopedic. Yeah, after we learn about the application of the mesenchymal stem cell, and now how to apply the secretome or the conditioned media, which means not the stem cell. There is no cell inside the conditioned media that we apply to the patient. There is no cell, which means cell-free, yeah, cell-free therapy that we apply to the patient. Which means that if the treatment is cell-free, there is no cell, so it will make the cost is lower, yeah, more cheaper, cheaper for the cost, and then the side effect, such as the cell, that potential that the cell become cancer, is zero, because we put no cell in the human body. We just put the secretome, the product of the stem cell, inside the injury site, the human body. So here, yeah, we can see here the previous study that the mesenchymal stem cell secretome not only allow a better mechanistic understanding of mesenchymal stem cell in tissue repair and disease, but also enable the potential development of next generation, ready-to-use, highly amenable, and cell-free therapeutic for clinical application. This is uh, very utopia or very daydreaming that wow, there is no cell such as maybe in if we play in game, yeah, RPG, or in playing maybe if you like playing, yeah, mobile games, yeah, you know that there is an elixir, yeah, elixir that can cure almost all the disease, and this is secretome is maybe such an elixir that can cure almost all the disease, cell-free, no side effect, and also ready to use, and most importantly, a low cost or a cheaper, yeah, cheaper in the if we compare to the stem cell, the cell-based therapy. And undoubtedly, there is paradigm shift from the cell-based therapy to cell-free strategies for cartilage repair. And this is in the cartilage regeneration, yeah, because as we know that if we talk about the cartilage, our cartilage in a knee, in the hip, yeah, in the joint, as we all know that the joint, our joint, is covered by the cartilage, yeah, and the cartilage is acellular, not acellular, avascular tissue. There is no vascular, which means that if there is the damage on the cartilage, and it will be forever because the cartilage cannot regenerate or purely regenerate into become a new cartilage, which means if there's a defect or the disease inside the cartilage, such as septic arthritis or maybe injury or osteoarthritis, so the only option is to operate to replace it with implants such as titanium, cobalt chromic, stainless steel, and etc. So we cannot make a new cartilage, but in this new era, that there is a hope that the cartilage can regenerate by using secretome or stem cell therapy. And in this era, that the therapeutic potential will only be realized through the further research to better understand the role of the secretome factor and chondrogenesis and cartilage mechanism. Yeah. Here is the one of the current research about uh, the application of the conditioned media or secretome in inflammatory arthritis. In this research, that they evaluate the therapeutic potential of the conditioned media to the mice, yeah, in animal model, and then the result is the CD4 plus T cell from arthritic mice treated with conditioned media, increasing FOXP3, which means FOXP3 is the expression for the cartilage regeneration. Yeah, maybe you have to understand that there are some growth factor or some marker, some potential protein that very important for the cartilage regeneration, and then the secretome can produce it, can make the stem cell around the joint, yeah, such as synovial stem cell, subchondral stem cell, bone marrow stem cell, yeah, that we call all of them resident stem cell, which means that the stem cell that reside inside the body, not from the outside, but is still inside the body, and we call it the resident stem cell. And the conclusion from this research is the conditioned media or the secretome provide an effective cell-free therapy for inflammatory arthritis. It will reduce the inflammation in the arthritic or joint. Yeah. Another research. Actually, this research is our my senior research, yeah, that I have, that we did together in 2018. That this is the research is aimed to evaluate the effect of conditioned medium from the umbilical cord mesenchymal stem cell on damaged cartilage through the expression of the protein. The expression of this protein is such as TGF beta. TGF beta is tumoric growth factor beta 1, and then SOX9, SOX9, and type 2 collagen. This protein is very, very important for the pathway to the cartilage regeneration. Yeah, so we need this protein to make the new cartilage, to regenerate the cartilage. So if we can produce, or we increase the amount or the quantity of this expression, protein expression, there is the potential that there will be a regeneration, increase the regeneration of the cartilage. And we did this research in a mice, yeah, Ratus noverticus, and then we evaluated using histopathological. So we euthanized the mice or the rat, and then we evaluated under the microscope, and then we evaluated using immunohistochemistry, and then we found that the TGF beta 1, the SOX9, and type 2 collagen and aggregan increase in the damaged cartilage of the rat, of the mice, Wistar mice. I think this is the mechanism that how the TGF beta 1, SOX9 can make new cartilage. Yeah, this is the seam of the cell. Yeah, this is in intracellular, and this is extracellular. Yeah, and then here this is a receptor. This cell is the chondrocyte. Yeah, chondrocyte. And then inside the cytoplasma, you can see here there is a SOX9, and then TGF beta 1 here, and if sorry, the SOX9, there is a SOX9, yeah, that can make this is the blue one is a nucleus. If the SOX9 can transmit or can go inside the nucleus, it will produce the new collagen. That the gene here, the mRNA or the gene here will produce or will transcript the new protein that such as collagen type 2. As we know that collagen type 2 is very important for the cartilage joint. Yeah, this is the seam, yeah. To understanding that how the TGF beta 1 and SOX9 and then the aggregan, yeah, take role in the collagen or in the cartilage regeneration. Yeah, this is another example, seam that can see here. There is this is the TGF beta 1, yeah. Okay, yeah. This is the TGF beta 1, and then this is the smart SMID, yeah. If the okay, between this the left the right diagram and the right diagram and the left diagram, the difference is if we use the BMP pathway, yeah, the BMP pathway will make the hypertrophic cartilage, hypertrophic soft tissue or hypertrophic cartilage, which means this is a very not good, because the hypertrophic cartilage will tend to become an osteoarthritis. But if we using the TGF beta pathway here, we can say here, this is will become the chondrocyte. It will become a good chondrocyte, not hypertrophic, but will repair the cartilage without any hypertrophic condition. Yeah, this is another thing that how the TGF beta is very important. Yeah, it will prevent the hypertrophic differentiation. It will prevent the mineralization, which means that mineralization is important in bone, but in a joint, in a cartilage, we don't need so much mineralization, because if we put the mineralization such as calcium and then so for calcium, the joint will become will harder, and then the joint will become a bone, not the joint, not the cartilage, but the bone or the fibrocartilage. This is very bad for the joint. It will make the patient painful. Yeah, and then if using the TGF beta pathway, the transcription factor to produce the collagen type 2 protein, aggregan protein, and other chondrogenic genes will express, and then the cartilage regeneration will occur. This is our result, our experiment result, and in mice, in the Wistar rats, that we can see here, there is an increasing in the TGF beta 1 and SOX9 histological marker using immunohistochemistry. Yeah. Also in collagen type 2 and aggregan is increasing. Yeah. In the 2 months and 3 months and 4 months. And we compare it to the control group. Yeah. This is very, very significant in the different in the treatment and the control group. Okay, and then we are not only use the histological assessment, we also evaluate it using immunohistochemistry. Yeah, and then we can see here there is a significant in all expression of the TGF beta 1, SOX9, collagen type 2, and aggregan compared to the control group that we did not using, we did not put the conditioned media or the secretrome. Yeah. Here, this is our research that lead by the Dr. Bintang. This is our he is our senior in orthopedic and traumatology department in Suwardi Hospital, Surakarta. Yeah, and then the summary of characteristic of result of study using conditioned media of the secretome. Here, the most commonly used method for the conditioned media administration was intracellular injections, which means that if we want to put the stem cell secretome or the conditioned media, we only have just using intra-articular injection, no operation. And maybe you can imagine that if we did that operation, if we want to apply the conditioned media or the secretome, it will make the patient scared. Yeah, it will scare the patient that, oh, I will do another operation, or I will do an operation. So we only just put it using the injection, intra-articular injection, because the conditioned media is cell-free. So we don't have to worry that there is an increasing in the cell amount, because there is no cell, only the secretome, only the protein. But if we want to inject using intra-articular injection of the cell, there is the potential that the cell will die during the injection process, because as we know that the shearing, there's a needle, and then the shearing, the pump, and then it make the cell dying in the process. And then the result is there was an improvement in cartilage repair and all in vivo studies. Yeah, in animal study, the cartilage repair is showing improvement, but all the study are still pre-clinical study. There is still no clinical study in this era, yeah, in this current research. Okay, and how about the exosome? This is also the exosome. Yeah, there's several study of evidence that the beneficial effect of exosome therapy on osteoarthritis. The therapeutic potential of the exosome that confirmed in vitro and also in vivo study. The exosome derived from the stem cell are different from the other cell. As we know that why stem cell, because other cells can produce also the exosome, such as the platelet, blood cell, yeah, all of this cell can produce the exosome. But why the stem cell? This is the research that showed that the exosome that derived from the stem cell are different. It can imitate the phenotype of parent stem cell and then holding a therapeutic potential. So the content of the exosome that produced by the stem cell has a potential, therapeutic potential compared to the exosome produced by other cell. And then exosome could protect cartilage and bone from the degradation of osteoarthritis by increasing the expression of the collagen type 2 aggregate that I previously showed you the mechanism. And then exosome could also attenuate the osteoarthritis by stimulation of chondrocyte migration and proliferation and decreasing inflammatory marker and regulate inflammatory response. So as we know that osteoarthritis, if we talk about the osteoarthritis, which means this is inflammatory disease. Yeah. Every disease in medical, yeah, in medical, if there is the end of the word, it is such as osteochondritis, spondylitis, and then this, yeah, it means this is the inflammation process. There is inflammation process, and then the exosome can lower the inflammatory process, can reduce the inflammation in the joint, yeah, in the arthritis cases. And exosome derived from the various type of the stem cell are highly potential comprised of different biological molecules. Okay. Now, this is one of the research that they're showing that exosome can develop is a potential therapeutic strategies. This is using mice, yeah, as a cartilage model. The mice, we make the rat become osteoarthritis, and then we treat it with the embryonic mesenchymal stem cell derived exosome, and then bone marrow mesenchymal stem cell, exosome, and then adipose. So they used embryonic adipose, yeah, the stem cell from the embryo, stem cell from the adipose, and stem cell from the bone marrow. And we evaluated, and all of them increase the cartilage matrix, increase the subchondral bone, and then reduce the inflammation. Yeah, and this is all of them is in vitro therapy. Yeah. Okay. Oh, yeah. This is almost the same. Yeah. Of the previous research, still the same research, that how the exosome contain protein, RNA, DNA, yeah, DNAs amino acid and metabolites. This is the exosome that produced by the stem cell. Yeah. So exosome is the, what we call it, the vehicle. Yeah, the vehicle, the vehicle, the vehicle for a delivery system of the important molecules such as RNA. So the exosome act as a gene therapy. This is the new concept, yeah. So the exosome can act as a gene therapy because it contains the RNA, the DNA, amino acid, yeah, nucleotide, and etc. that will entering the cell, the resident stem cell, or the chondrocyte that have been injured, and then make the repair of the cell and the tissue surround the injury site. Okay, yeah, this is such as why exosome roles as the potential in osteoarthritis because it acts as the vehicle that contain the important important molecule that will make the reparation of the joint of a cartilage. And how about, we already talked about the conditioned media, this and then the exosome, and how about the tissue engineering progress? As we know that the tissue engineering is very important and very promising because it will enhance the potential therapy of the secretome and the exosome. Yeah, this is the in vitro study that showed this the effect of the cellular cartilage bovine scaffold. So we take the bovine, yeah, the bovine cartilage, and then we remove the cell, yeah, we decellularize. So they remove the cell, and then we make in hypoxic condition stem cell differentiation on the chondrocyte. So the if we did the decellularized cartilage, the chondrocyte will erase from the cartilage, the bovine cartilage. So the cartilage only contain the matrix. What is it? Collagen type 2, and then the mineral matrix, and then hydroxyapatite, and etc. Yeah, glucosamine, and then polyproteoglycan. Yeah, that is this is very important matrix or very important matrix in the for the cartilage. So we try to put the stem cell, yeah, the stem cell. We try to cultivate the stem cell inside this scaffold, the decellularized cartilage as a scaffold, as a media, and then after 5-week treatment, the result they showed that highest expression of the SOX9 and collagen type 2 were found within the group that used the combination of the scaffold and chondrogenic medium in hypoxic condition, which means that the cartilage tissue engineering has proven its effectiveness for cartilage degradation, and then using the biomaterial scaffold will enhance and resulting in better cost and resource efficiency. So our dream, yeah, our dream is for the future, that there will be no operation for the osteoarthritis. There will be no implant. That is, there will be we will never put an implant. No more implant for the osteoarthritis because we already can we can regenerate. Yeah, we can regenerate the cartilage defect using the tissue engineering and stem cell therapy. That's the dream, yeah. Still ongoing, but I will show you that what is our challenge, and then what is our future perspective, and then our message, yeah, for us to work together that for healthier community. Okay, and we talk about the cartilage here. And how about the bone itself? Yeah. So here we see that the bone, yeah, you can use it as a bioreactor, that as a new resource of autological bone graft to overcome bone defect in vivo. So this study is already is already in vivo. Yeah. So we are using the scaffold, yeah, with the tissue engineering, and then we put it inside the bone. So this is another dream. Or we may see, if you like science fiction, yeah. If you like science fiction film, yeah, science fiction movie, we can see that, wow, there is a heart transplant, and or a bone transplantation that made it outside the body in the laboratorium. We make a new bone, or maybe in extreme film, yeah. They grow a hand, yeah, they grow a leg, and then they put the new leg into the amputated injury or amputated leg of the another or of the patient, yeah. Amputated leg patient. That's an extreme condition, and this research is the prototype, is the start of that the dream, yeah, the science fiction movie that if you watch the movie, that, wow, yes, that will be possible, maybe, yeah, in the future. I mean, yeah, in this, yeah, and then this is the 3D technology, yeah. If you maybe if you already have did the laboratorium, in the laboratory, you did the cultivate the biological cultivation of the maybe cell, yeah. You did it in, what we call it, uh, petri dish, apa, cawan petri. Petri dish. That's not this only two-dimensional, because the cell will grow in one layer, only in one layer. But if we did the culture, the cultivate or the culture in the three-dimensional, three-dimensional media, so we will have the multiple layer cell that become the three-dimensional. If you only cultivate the cell in the traditional method, you only have one layer. But if you using the 3D, yeah, so you will get the box, the three-dimensional box that we can put it directly to fill the defect of the injury. It will be very, very, very good and very promising. Yeah. As we know, there is also a 3D printing, and we can use the 3D printing for the scaffold, for the media, for to culture the cell, yeah, the stem cell. Yeah, and then the future perspective of the exosome. This is the exosome is cell-free biological feature of exosome. Besides that, the application may provide higher efficiency. The current therapy requires repeatedly local administration for maintaining the effective concentration. Produce pain and risk of side effect. We need local control risk of exosome. Exosome will be a political therapeutic, yeah, political therapeutic tool for personalized and precision treatment of osteoarthritis therapy in the future. Not only osteoarthritis, arthritis actually, many disease that can be treated using the three-dimensional by tissue engineering and exosome. And I will show you in the next slide. Yeah, this is the slide that I mentioned, that the progress of the regenerative medicine in other departments, not only in orthopedic department. Yeah, and we know that the orthopedic department talk about the bone, joint, muscle, ligament, yeah, and etc. But how about in other departments such as neurologic, heart disease, yeah, lung disease, or intestinal. Now here, there is also some research that in 2019 that collagen biomaterial using to treat the myocardial infarction. Myocardial infarction, which it will make the heart disease, yeah, in the heart, in the cardiac tissue. So if we call it every day, yeah, we call it penyakit jantung koroner or coronary heart disease. It will make the tissue of the heart, yeah, the cardiac tissue damage, necrotic, infarct, yeah, because of the hypoxic due to the obstruction of the vascular coronary artery. Okay, and then how we treat it with using the biomaterial and the secretome. Here, this is the research that makes this it possible. In the conclusion, that the optimal delivery route and time of collagen-based material still remain unknown. Yeah, the delivery method, such maybe how to deliver, yeah, how to deliver the stem cell into the heart. Yeah, this is still remain unknown. But by the future research, the collagen-based biomaterial will become a type of promising biomaterial for cardiac tissue engineering and regeneration. So we can make the heart tissue, yeah, outside the body, and we replace it, the defect, the damaged tissue in the heart, yeah, using the tissue that we made it earlier outside the body. Next. Okay. Yeah, and then this is tissue engineering material in cardio, also in still in cardiovascular surgery. Yeah, you can using the allogenic, xenogenic, yeah, in from the human, from the ovine, yeah, like this. And how about in the plastic surgery, plastic and reconstructive surgery, and yeah. So in the reconstruction surgery, the secretome or the mesenchymal stem cell can use surgical reconstruction using bioengineered tissue as the potential to revolutionize the clinical practice. And then still there have been a steady increase in basic science activity and cell therapy, and a growing portfolio in cell therapy trial. And we can see here the successful application of the tissue engineering construct in human, such as in the bladder, yeah, and then in trachea, in urethra, and also nasal cartilage, yeah, here. Yeah. If you want to make your nose more sharper, yeah, you may use the stem cell. Yeah. Yes, yes, in the reconstruction, yeah, if you have a damage, yeah, on your nose, yeah, and then you can you may use the stem cell to make to repair to reconstruct your nose, and also the vaginal organ, pulpal biopsy, epithelial, and muscle cell. Okay, okay, and this is the in urethra, yeah, tissue engineering urethra. Where are we? The tissue engineering of pathology tissue of urethroplasty is expensive, yeah. It is unnecessary for the majority case, but could be potentially useful for the very lengthy stricture. So if you have, if no, I don't want to, I don't want you to have the disease, yeah. If there is a patient, yeah, if there is a patient that have a stricture, the damage of the urethra, they cannot pee, yeah, they cannot pee. So it can be treated with the stem cell, yeah, and tissue engineering to potentially to make to repair the urethra. So we call it urethroplasty. Okay. And how about in spinal cord injury? As we know that the spinal cord injury, yeah, and spinal cord injury is very disaster for the patient, because if the patient have the spinal cord injury, the patient cannot move the leg, yeah. Maybe in previous a news, previous news that there is a celebrity, an artist that have a car accident, and then they have injured. She injured the spinal cord, and then he and she had paralysis both of leg, both of the leg. I think not artist but celebgram, celebgram. And then they cannot move the leg, they cannot walk. She cannot walk, and after that she paralyzed, uh, forever, and then it will be necessary to investigate the optimal chemical structure, porosity, and morphology of biomaterial used for the transplantation sample. So in vivo study in 2019, the biomaterial using such as fibrin can be used to transplant, to repair the spinal cord, and it will so promising. But it still needs more investigation to evaluate the chemical structure and the morphology of the biomaterial for the stem cell transplantation. In this in vivo study, they are using the scaffold or hydrogel. Maybe if you have an idea, using another biomaterial, for the scaffold, you may do the research. Okay. And this is a special case, special that I present to you about the COVID-19. How the stem cell or the secretome or cell-based therapy treat the COVID-19. This is a very emerging study that we did. Actually, our hospital, Dr. Muwardi Hospital, involved in the COVID-19 experimental using mesenchymal stem cell. As we know together that COVID-19 infection causes respiratory problem, lung problem, with a need for ICU and very high morbidity death rate. And COVID-19 has a high transmission rate and spreads quickly. As you know that the COVID-19 is very quickly spread quickly using you have to do the physical distancing and then using mask every day, and etc. And currently, there is no effective therapy in clinical practice. Most cases receive only supportive therapy to relieve the symptom. Even the patient in an intensive care unit or ICU, there is no effective therapy. They combine the therapy, anti-inflammatory therapy, and then the therapy for the lung, and to prevent the bronchospasm, and etc. So there is no effective therapy, just symptomatic therapy. So we need an effective therapy, and this is a serious and life-threatening global health problem. And then in the world, in other country, they already write the review about the stem cell therapy for COVID-19, and they ask that, is that really promising? So the stem cell have been shown to improve the organ function because they have ability to proliferate and differentiate for organ regeneration that we have learned earlier. And then stem cell can induce immunomodulating effect through the paracrine secretion and crosstalk message to the other immunologic cell. And why we are using stem cell or cell-based therapy for to treat the COVID-19? Because mesenchymal stem cell, this is UCMSC, is umbilical cord base, that our study has been shown to play a role in curing various disease, that I mentioned earlier, that almost all the disease can be treated with the stem cell therapy. So how about COVID-19? Yeah, various studies have demonstrated the anti-inflammatory effect of the mesenchymal stem cell and significantly reduced virus-induced lung injury and death in animal model, in animals, still animal. Nah, this is the mechanism, yeah, a slide mechanism how the mesenchymal stem cell treat the atau to eradicate to treat the patient that it had been infected with the coronavirus. Here we can see here that umbilical cord mesenchymal stem cell can inhibit the lymphocyte or the cytokine storm, and then it can make the endogenous repair, and then it protect the alveolus. Yeah, because we know the alveolus is the part of the lung, yeah, and that is infected with the coronavirus, and then it will protect the epithelial of the alveolar, which means if they protect the epithelial of the alveolar, the exchange, the gas exchange, oxygen, carbon dioxide, yeah, from the in the alveolus is still remain, and also the immunology, uh, the immunomodulatory effect. So immune depletion can be repaired the immune system using the mesenchymal stem cell. And why promising? This is from the European Respiratory Journal that the current status of cell-based therapy for the respiratory infection applicability to COVID-19. Yeah, and for COVID-19 patient with the acute respiratory disease, lung disease, yeah, a viral-induced cytokine storm in the lung can trigger pathogenesis and is a major target of therapy. So our major target therapy for the COVID-19 is to prevent or to treat the ARDS, yeah, acute respiratory distress syndrome. An increasing number of clinical trials of the cell-based therapies, especially those involving mesenchymal stem cell and using conditioned media or extracellular vesicle in viral infectious disease. Yeah, it's still increasing number in clinical trials. Yeah, so and actually we need more clinical trial to treat to make sure that the mesenchymal stem cell is applicable to treat the COVID-19. And how? Yeah, this is the short communication in the Medicine and Drug Discovery Journal that the COVID-19 enter the cell via ACE2 receptor in human cell, yeah, and in cell alveolar, yeah, in alveolar, and it can capillary endothelium, and stem cell possess high activity of anti-inflammatory regenerative factor. So the stem cell have anti-inflammation such as TCF Beta, yeah, IGF, yeah, growth factor, yeah, LEF, FEGF, yeah, vascularized endothelial growth factor, EIGF, BDNF, and NGF. They demonstrate all of these growth factor, all these factors are anti-inflammatory factors, and demonstrated that the immunomodulatory properties of the mesenchymal stem cell are long-term and actively maintained by continuing cytokine production. And two recent studies from China, mesenchymal stem cell can be used as a therapy for COVID-19 pneumonia. This is the report, yeah, two recent study, the reporting study. Yeah, this is the study from the Liang Bi et al. Yeah, from China. They report the case of COVID-19 patient in critical condition. They are using ventilator who continue to deteriorate despite intensive therapy with liver damage. Yeah, not only the lung damage, but also their liver have been damaged. The patient were treated with the allogenic human umbilical cord mesenchymal stem cell. They treat the patient with the stem cell using 3 intravenous infusion. So the stem cell delivered using infusion. So which means intravenous. Yeah, they deliver the stem cell inside the vein. Yeah, inside the vein, and then about times 10, 3 days apart. 4 days after the second infusion, the patient no longer needed a ventilator and was able to walk. Wow. This is very dramatic. It's so dramatic that uh, dramatic result, that the patient can no longer needed the ventilator and able to walk, and the parameter measured, including number of the T cell and returning to the normal level, lymphocyte count and lung inflammation, and there are no obvious side effects. Wow. As we told earlier, that the stem cell, such as an elixir in if you're playing a mobile game, or RPG game, this is just like a dream elixir, anti-aging direct elixir, the elixir, the drug that can cure almost all the disease. And then this is the previous study is using intravenously, either intravenously. Okay. The screen sharing stop, oh, sorry, the connection broken. I will try to share again. Sorry. Please, sorry, please wait a minute.
If you need an assistant, just send me the PowerPoint doc.
No, just actually the connection, trouble in connection. I will try,
Okay.
to connect it today. I don't know, because maybe actually our connection is 5G, but I don't know if broken, maybe because I don't know, but we will connect soon. Okay. Yeah. Okay. Going again. Try to speaker. Maybe you will you enable my screen sharing? Enable the participant screen sharing for me. Can you make
It is
my
done,
account?
doc.
Yeah. Can you make my account to enable? Oh yeah. Okay. Already. Sorry. Okay. Yeah. Yes. Yeah, I'm back again. Yes. Yeah. Yeah. In a previous research that we talked about the the transplantation, yeah, the injection using the intravenous injection of the stem cell. But in this research, yeah, they transplant the AC to mesenchymal stem cell, and then it improve the patient with the COVID-19 pneumonia. This is the clinical trial. The treatment is the single dose of intravenous mesenchymal stem cell, and then 14 days after the transplant did not show any side effect. Yeah, still no side effect, but within 2 days, all patients had significantly improved lung function. One of the severe cases can be discharged on the 10th day. Wow. And you may imagine that these severe cases can be discharged in the 10 days, and overall lymphocytes increase. Yeah, and the inflammatory cytokine significantly decrease. Yeah, and we know that inflammatory cytokine will make the cytokine storm, the cytokine storm, and the inflammation is decreased. Yeah, using the transplantation of the ACE2 mesenchymal stem cell. Now, this is the lung. Yeah, the image of the lung. You know here. In January of 2023, this is the lung still have no sign of pneumonia, yeah, and then the next day, yeah, start increasing the hyper intensity, yeah, the white one, yeah, this is the CT scan, yeah, the white one is the pneumonia, and after we treat it with the stem cell, we can see here this is the arrow that I made, that from here, yeah, from this kind, yeah, this damaged lung. Many white, yeah, many damaged lung here, white hyperintensity, which is the pneumonia, and become clean again. I can hear here, it turned to black again, hypointensity again, which means the pneumonia they reduced. This is the radiology result of the patient with severe COVID-19 pneumonia treated with the mesenchymal stem cell therapy and improve on the next month. Yeah, they only need about 1 month, yeah, to improve. Yeah, from the January 23 to 15 February. Has mesenchymal stem cell used as therapy? Because this is very promising. And how about why don't we treat all the COVID-19 patient in intensive care unit, yeah, in a severe case using mesenchymal stem cell? It's a very long way to go. Why? This is the recommendation of from the FDA. Yeah, the COVID-19 treatment guideline panel recommends against the use of mesenchymal stem cell for treatment of COVID-19. Yeah, generally, except in a clinical trial. So it's still possible if the patients is the patient of the experimental patient, yeah, the clinical trials, a part of the clinical trial patient. And no mesenchymal stem cell are approved by the FDA for the treatment of COVID-19 because there are still insufficient data to assess the role of mesenchymal stem cell for the treatment of COVID-19. So actually, we need more data. Yeah, we need more and more experimental. We need more and more research to make the mesenchymal stem cell become the first treatment, the recommendation treatment for the COVID-19. Yeah, because yeah, the FDA is very strict. There are many critics, yeah, to the stem cell that treated using COVID-19, such as how about the patient is still low, yeah. They don't treat maybe they need a 100 patient or more, yeah, to make them sure that the COVID-19 is very promising. So this I will show you the step by step that the drug, yeah, we treat the stem cell is a drug, yeah. This is the pathway of the clinical trial. Yeah, all trials are early. All trials in the for the COVID-19. Yeah, mesenchymal stem cell are only in phase 3 or 4. There are no 3 or 4 studies yet. Still 0, 1, 2, phase 1, phase 0, phase 1, and phase 2. Phase 0 is the initial exploratory study that non-blinded RCT, yeah, randomized control trial. And phase 1 is human safety, yeah, confirmation that safety, that therapeutic. And phase 2 is therapeutic confirmation. And the phase 3, assessing efficiency, effectiveness, and safety. So it's still, yeah, not long way, but what we call it, we still we have to try harder to entering the phase 3, yeah, to make the stem cell as the treatment for the COVID-19. Yeah, still we need we need more research to do this to make the stem cell become the drugs. Yeah. Nah, how about Indonesia? Yeah, in Indonesia, actually, Rumah Sakit Umum Daerah Dr. Muwardi Surakarta has done the clinical trial using the RCT method, yeah, randomized control trial, using, yeah, and then collaborate with the Sarjito and Hasan Sadikin Bandung, yeah, hospital, to treat to find the efficacy and safety of allogenic umbilical port mesenchymal stem cell for the COVID-19 in COVID-19 severe patients. Okay, and this is our sponsor, yeah. We have a grant from the Kemenristek BRIN, yeah, and then from the Bipar Madi Luhung, yeah, Stem Cell Cancer Institute that provide the stem cell. Now this is the, if you want to, if you are interesting, if you're interested, yeah, if you're interested to do the research of the stem cell, yeah, maybe this is the book that I recommend you. That this is the guideline, yeah, for the stem cell research and clinical translation. So our research of the stem cell is very promising. Yeah, the research of stem cell is very promising. It's still open, globally open, and then you may start this research, yeah, in vitro, in vivo, or even in clinical trial. Yeah, you can do it yeah, which one that you like. Yeah, yeah, in vitro it's okay, in vivo okay, and even in clinical trial it's very okay, because we still need more and more research, yeah, fundamental research for the stem cell, to make the stem cell become the elixir that I said earlier. Okay, this is the challenge, yeah, that we have to face, that the compatibility of autologous mesenchymal stem cell and the immune system, and the risk of obtaining defective mesenchymal stem cell from unhealthy donor. Nah, we have to be careful that the donor is unhealthy, so we have to strictly screen the donor, yeah, the mesenchymal stem cell donor, because if we want to use umbilical cord, yeah, so we have to find the very healthy mother that have been delivered the baby, and also we take the umbilical cord, and we have to make sure, we have to do the several tests that make sure that the umbilical cord is bacterial free, from bacteria free, from virus free, from toxin, and etc. And then recent study indicate the allogenic mesenchymal stem cell trigger antibody production and are prone to rejection. Yes, there is still the possibility of rejection of the mesenchymal stem cell. So how to prevent the rejection? That I said earlier, that I learned, I talked to you earlier, that we may use the cell free, the cell free, the previous, the secretome, only the secretome, not the mesenchymal stem cell, is a low rejection. And then variability in cell resource, in cell sources, such as umbilical, bone marrow, adipose, synovial, blood, and then etc. Cell source for the stem cell, doses and dosing interval, isolation, culture, and expansion protocol, and also our challenge is it is expensive, very expensive, because the expensive which one is expensive? The to treat, to treat, to maintain the cell, to cultivate the cell, to deliver the cell, and also to distribute the cell. It needs a very strict, good laboratory practice. Because I have done several research about the stem cell. Then you may imagine that I was carrying the stem cell, and then suddenly I just maybe did unbalance, and it makes the cell die. It makes the cell die. So it's very so strict. And if the cell die, you can imagine how many billion rupiahs that will be wasted if the cell dies. So it's very expensive, and need further and continuing research to make it more stable. Not to make stable between the longevity and the cell, the survivability of the cell, not easily die. And then ethical controversy, if you are using the embryonic stem cell, the ethical controversy, because as we know that embryo is they consider embryo as organ, as human, as the whole human. They have life, not the cell. But bone marrow, umbilical cord, maybe a placenta, or adipose tissue, there's no ethical controversy if you want to use the stem cell. But I can message that the ability of the mesenchymal stem cell to regenerate and differentiate make the cell become a promising new therapeutic agent to replace and healing the defect of this tissue. And biomolecule synthesized by stem cell may be as important and induce differentiation of the cell in eliciting functional tissue repair. And then secretome, exosome, and extra microvesicle. Stem cell, metabolic tissue engineering, and force media has been proven in animal and human therapy. Some has been started in phase 3, still started in phase 3, not complete. As in our study, we are able to show the healing effect of condition media of stem cell to repair the cardiac defect. And then we have a lot of challenge. But we have to believe, that the stem cell are able to emerge and improve our recent molecular therapy in the future. Okay, I think that's all, Ms. Nurul. Thank you very much. I will back to the host. Thank you.
Okay. Thank you very much, Dr. Denny, for the information and knowledge. I'm sure this is very useful for all of us, even though we might try hard to understand it, but with interesting examples, it becomes conceivable. And scientific developments are wonderful, so I think we got a lot of new things today. Dear student, while the next session is a question and answer session, for the audience who want to ask a question, just raising your hand and mentioning your name, or you can write in the chat box. You will write. Okay, we have the first question from Awalia. Thank you, Dr. Denny, for your explanation. I would like to ask about stem cell. Do stem cells have a role in treatment of COVID-19? And what factors are considered when determining if a stem cell transplant should be delayed. Thank you.
Okay. Maybe I'm just direct answer the question, yeah, Ms. Nurul. Okay.
Okay.
Yeah. There is yes, there's a promising effect for the stem cell to treat the COVID-19. Actually, in a severe condition. So we don't talk about the patient that isolasi mandiri, no, an asymptomatic patient that we just talk about the patient that severe condition in ICU using ventilator, yeah, and in this very critical ill patient. Now, this is the patient, the candidate is the candidate for the stem cell treatment for COVID-19. And in several study, in phase 2, phase 1 study that I stated earlier, yeah, they improve, yeah, they have there is an improvement in lung, yeah, and then the patient can discharge quickly, more faster than the patient that the without the stem cell. Maybe if the patient, the control patient that maybe I will just give you some bocoran from our study that some of the patient that are control patient, our control patient, they died and because we did not give them the stem cell, but we did the protocol, we did the standard procedure, yeah, to treat the COVID-19, but we did not give the stem cell. But some of the patient that we give the stem cell in critical ill condition, actually they have an improvement. They improve, yeah, they improve, and then they don't die. Yeah, I think that maybe this is some of our result that our research result. And yeah, actually the COVID the stem cell therapy treatment for the COVID-19 is very promising for the critical ill or in severe condition patient with using ventilator in intensive care unit, and but not for the asymptomatic patient. So if you only have you just have COVID-19 and you did the isolasi mandiri, yeah, and then you just have mild cough and there is no obstruction, no deep snow, your breathing is still good, your saturation is maybe about 99, 90, 90, 98, yeah. I think you don't need the stem cell. Yeah, I think that's my answer, Miss Nurul.
Okay, thank you, Doc. And then we continue with the question from Dimas Pupu. Okay, he asks why cell-free based tissue engineering using exosome isolated from stem cell is regarded an alternative approach in regenerative dentistry.
I'm sorry. What is the question again?
Why cell-free based tissue engineering using exosome isolated from stem cells is regarded an alternative approach in regenerative dentistry?
Oh yeah.
Okay.
The question. Yeah, because the exosome is cell-free, yeah, and cell-free, and we know that the conditioned media, yeah, in the conditioned media, I mean, if we talk about the conditioned media, we talk about the culture media, the cultivate to cultivate the stem cell. So if we did the cultivation of the stem cell inside the media, and then we remove the cell, we only have the conditioned media, and inside the conditioned media there is secretome, yeah, and the secretome, yeah, contain molecule, yeah, biomolecule, and then exosome. Now, exosome is different than the molecule. Molecule, if you talk about the molecule only is a growth factor. Yeah? It's only only protein, and a dead body will be apoptotic body. But the exosome, this is such as a vehicle, vehicle. Yeah. It contains the important molecule. They contain the nucleotide. It contains the RNA, ribonucleic acid, that can be used as the gene therapy, that can be used as therapy, because exosome is can be used as paracrine effect, messengering. I mean, the cell using exosome to communicate extracellularly, intercellularly. So the exosome will trigger the resident stem cell or the chondrocyte. Yeah, if we talk about the cartilage, yeah, it will induce the cartilage to repair the injury site. And why exosome? Yeah, why exosome? Because exosome is cell-free. So that maybe if you watch out my presentation, my lecture in part 1, that the mesenchymal stem cell still have side effect, such as it became cancer. Yeah, it still a possibility to become a cancer cell. But if you do not using the cell, so it's very safe. There is no risk. Uh, there is no risk to it the exosome become tumorigenic or become the cancer cell, because there is no cell. But the exosome still have the same potential, still have the same potential effect, the therapeutic effect, such as the stem cell. I think that may answer the question.
Okay, thank you, Doc. Some of our participants is from Bicycle Education Department. And then we have the third question. Can stem cell be used to repair cells or organs that are badly damaged? For example, bones that are broken into pieces and organs or cells that have decay? Maybe like Wakanda.
Yes. My answer is yes. Because as you know that that I mentioned earlier, that if you only you have the bone, you have the broken bone that turn into pieces, and then prepare a broken, and then but if it is there is no defect, there is no defect in the bone. Maybe you just only have to operate it. You put the implant, and you don't have to use the stem cell. But if the bone did not want to, they don't want to unite. They don't want to unite, and we call it non-union. The fracture can heal over time. We may use the stem cell. We may use the stem cell, because which means that there is something wrong with the damage, the bone, that why it cannot heal. So we can treat it with the stem cell, because the stem cell can make the new bone. And also the secretome also. The secretome, as we know that the bone, the structure of the bone in the medulla, they have the bone marrow. The bone marrow have the stem cell, and the periosteum of the bone have the stem cell. If we put the secretome, it will induce the resident stem cell, the periosteum, the bone marrow. It will enhance it to become a new bone formation. So secretome and then mesenchymal stem cell has the potential therapy for the bone that cannot unite over time, cannot be united over time. And also in other tissue, such as maybe the defect in the heart or lung injury, and then that we show you earlier about the urethra. Yeah, they have the potential to replace it to replace the urethra, the cardiac defect using the stem cell in the same manner mechanism. I think that's the answer.
Okay, thank you for the detailed information. And then the fourth, what is the percentage of stem cell failure considering the price very expensive? Thank you.
Sorry, the failure?
The failure considering the price is very expensive.
Oh yeah, okay. Yes. Yeah, the failure, yeah. If you talk about the failure, yes, there is a very frequent failure. That's very frequent failure. Yeah, that's that failure that make I think the failure make the stem cell research is very expensive because it tends to fail. Because it tends to fail. That's why it's very expensive, very costly, because it tends to fail. Yeah, because the cell, yeah, we talked about the cell, is very unstable. It's very easily to die, and yeah, that's why if we don't have, we may cultivate the cell, yeah, if we can cultivate the cell. In my experience, yeah, I try to cultivate the cell, and then I already did the good laboratory practice, yeah, in sterile condition, in a good chamber, and a very sterile, and a very in a very good manner. But the result, after I culture the cell, no growth. There is no growth in the in our in my culture. Wow, I think I'm going to cry at that moment. Yeah. Yes, the failure. Yeah, because of that failure, that makes the research. Yeah, the stem cell becomes expensive, and then why in this new era we are using the secretome, not the stem cell, not the cell, because the cell is very unstable, but the secretome only contain protein that will be very stable. We can freeze dry the protein. We may freeze, we may put it in the freezer in -20 degree. It still have an effect. This is the protein is still in a good condition after we freeze dried, or just freeze we just or chill, yeah, the secretome, the protein, and then we thaw again, yeah, freeze thawing, yeah, the protein is still in a good condition. So if you want to start the research, maybe you may start with the secretome, not the cell. But if you already have experience to interact with the cell, yeah, you may try the stem cell research. Yeah, I think that's it.
Okay. After failure, there is always success, yeah, Doc. Okay, and then the question from Alvia, what is the mechanism from cell-based MSC therapy to a cell-free strategy for cartilage repair?
What is it? Cell-free therapy?
Yeah, cell-based MSC therapy to a cell-free strategy for cartilage repair.
Okay. Yeah, actually, this is the emerging, yeah, the emerging therapy that in this new era, the new paradigma, the new paradigma that the stem cell, yeah, is not considering that the cell that will proliferate, that will turn into the targeted tissue, because the cell will die, in the process inside the body, the cell will die. So why the tissue damage repaired, even the cell dying, the cell died. Now because the stem cell produce the secretome. This is the new paradigma, yeah, the new paradigma. This is the new thinking, the new research, yeah, in this new era. So why we make our life harder, yeah, to put the cell into the body? Why we only just put the product of the stem cell? So that's why the cell-free therapy is promising, is very promising and more emerging, and now is very sexy to the for the researcher to apa to collaborate, yeah, with clinical, with clinician, with the laboratorian, yeah, to do the secretome experiment rather than mesenchymal stem cell experiment. Yeah, that's it, I think.
Okay, thank you. And the next question: what environmental factors can influence stem cell to differentiate?
Okay, environmental factor, yeah. I think there are so many environmental factor, yeah, that makes it depends on the cell. It depends on the what we want the stem cell to be. If you want the stem cell to become the cartilage, so we have to provide the the cartilage condition. I mean, we have to make the stem cell become fibroblast like cell. So we have to treat, we have to put in the media such as a collagen, then cartilage growth factor, yeah. Yeah, so we put the growth factor in the cultivate media that make the stem cell turn into the cell that we want. If that I did in my experience, yeah, that I did, that I make the stem cell. I want the stem cell to become the fibroblast like cell. So because fibroblast like cell can turn into the bone, can turn into the cartilage, yeah, can turn into the ligament, and as needed as an orthopedic researcher, an orthopedic surgeon. If you want the cell to become a heart, yeah, heart cell or cardiac tissue, so you have to put the factor, the growth factor that makes the stem cell become the cardiac tissue. Yeah, maybe that's the imagining, the basic principle, yeah, of the to cultivate the cell. But and we know that the stem cell has the potential to become to make themselves turn into the something that we want to target. So some of the researchers, they don't want to they just put the stem cell, they just cultivate the stem cell. So the stem cell, the quantity of the stem cell increasing, but it's still it's still the mother cell, it's still the stem cell, not become the fibroblast, not become the cardiac tissue. This is the stem cell, but they just put it that cell into the cardiac, for example, or the cardiac tissue. So they will proliferate, yeah, because the environmental inside the heart, yeah, inside the heart organ will make the stem cell turn into the heart cell, into the cardiac tissue. Yeah. And then also in orthopedic, yeah, in the bone, yeah, we just put the stem cell into the environment, into the for example, into the bone, yeah, and it will turn itself because the environmental of the around the bone the stem cell will communicate, will communicate paracrine effect using exosome and then and etc. They will communicate and they will turn themselves into the bone. I think that's the basic principle. But in this new paradigm, the stem cell that we put into the bone will eventually die over the day. Day 1, day 2, day 3, they die. But the product of the stem cell that they produce during the 4 day, during these days, make the stem cell around the tissue, the resident stem cell that we said earlier, turn into the bone. This is a very new paradigm that makes why the cell die, but the injury cure. Why the cell die, but the patient healed. Okay. That is the new paradigm of the treatment of stem cell to the injury site. Okay, I think that.
Okay, thank you. We go to the next question. Can stem cell be used to treat cancer patient, and is that can replace radiation therapy?
Yeah, that's I think a very good question. For a cancer, for cancer, I think there is still a limited, very limited data because as we know that the cancer is the cell turned into the cancer. So in our logics, in our knowledge, that if we put the stem cell into the cancer cell, there will be a potential that the stem cell turn into the cancer also. So there are only a limited research, and if they still in vitro, outside the body, outside the body research, that they treat the cancer using the stem cell, and then the cancer die. But it's still very limited and very limited publication about that about the treatment. But it's still a potential. It's still promising. It's, I think, still feasible, because why? Because stem cell has the potential immunomodulatory effect. They have anti-tumorigenic also. So in the mechanism of the stem cell to treat the cancer cell, it means that the stem cell will produce anti-tumor. The stem cell will produce anti-tumor factor to treat the cancer cell, but it's still in the investigation. It's still in the, so we never did. We still did not use the stem cell to treat the cancer. We still did not use the stem cell using it. The treatment for the cancer is still in the traditional protocol that have been proven. Such as chemotherapy, excision, surgery, and then radiotherapy. So it's still a long way to go for the stem cell to treat the cancer cell. But yes, this is feasible, still feasible. And it's very logic that the stem cell can treat the cancer. Okay.
Okay, Doc. And then the question from my colleague, Cecilia. Stem cell technology is very expensive. What about its effectiveness and efficiency? Because many even, especially in Indonesia, are not solved using this technology.
Thank you. Despite the high cost or costly and very expensive, the stem cell is very promising. Because I think so. The cost, the cost and the benefit the benefit and the cost of the stem cell treatment to treat the disease is still 50-50. I mean, worth it. It's still worthy because of why? Because in high cost, even it is very expensive, the result is very good. But we are clinician, we are researcher, want to make that why the stem cell is very expensive. How? We all think that it can be pressed. Yeah, the cost it can be pressed. The cost it can be can make it. We will make it the cost lower. Yeah, we become it more cheap. We can make it cheaper, not expensive. This is our duty as a researcher uh, that want to make sure that uh, even if the result is very promising, even the result is very good, we still want to press the charge, yeah, the cost of the of the of the cost of the stem cell. So we still need more research and we still need more thinking the method that how to make the cell-based therapy cheaper. Our thinking, yeah, uh, our knowledge, start with the secretome. Secretome is way more cheaper, way cheaper than the stem cell. I think that.
Okay, and we still have a question from Nadia. What is the difference the stem cell acquired from the fetus, which stem cell are obtained from adults?
Yeah, okay. Thank you. Good question. Yeah, the stem cell can be obtained from the adult. Yeah, yeah. Just please make sure that your thinking is this: every body, every human has their own stem cell. Even older, even older elder people, yeah, even elder people still have stem cell, but maybe the amount of the stem cell is decreasing, but they still have stem cell. The stem cell is still have the active, have still good survivability, have still a good condition, even the patient is elderly. This, but that you have to put it in your mind. So using the secretome, using the secretome, using the exosome or cell-free therapy, we still able to treat the patient using the secretome because the patient, even in elderly patient, still have the stem cell. Yeah, we have so many stem cell inside our body. Yeah, such as the synovial. In our synovial tissue, there is stem cell. In our bone marrow, there is stem cell. In our periosteum, the cover of the cover covering our bone, they contain this mesenchymal stem cell. And in our heart and in our lung, our brain, even our brain, our organ have stem cell. So to treat it's very possible and very feasible to treat the patient using the secretome because all the people have the stem cell, and we call it adult stem cell. We call those stem cell, synovial, bone marrow, adipose tissue stem cell. We call them adult stem cell. And if the stem cell derive from the embryo in morula, blastula phase, we call it embryonic, and that is controversial, controversial because uh, we all believe that even the the human in a fetus, still in fetus phase, in morula, they already have life. So we take the stem cell from the embryo, which means abortus, yeah, abortion, and then uh, we this is a murder. Gitu. We think this is a murdering the human if you use the embryonic stem cell. So the embryonic stem cell is controversial, but adult stem cell is very promising. Yeah, I think that.
Okay, thank you, Doc. Yeah, we still have a question. Whether joint pain is a symptom of osteoarthritis? If there is pain in the joint area, so that swelling occurs, what needs to be done? Maybe it's just her experience in.
Yeah, I'm sorry. In cartilage, in osteoarthritis, yeah.
Yeah. Whether joint pain is a symptom of osteoarthritis, if there is pain in the joint area, so that swelling occur, what needs to be done?
Oh yeah, if that swelling occur in osteoarthritis, yeah, the swelling condition of the joint, yeah, telling you need to meet the orthopedic surgeon, yeah, to make a more physical examination and radiological examination before treating with the joint, because we have to find the diagnosis first. Not all the swollen condition, that not all the swelling of the joint is osteoarthritis. You can have maybe, yeah, maybe the patient has the conitis tuberculosis. Yes, it's still possible, or infection, septic arthritis, or even tumor, even cancer around the joint. So please be careful and meet your doctors before treating any disease. Yeah. Thank you.
Okay, thank you. And then the next question, what are the most fatal side effects of a stem cell transplant?
I'm sorry, what is the most fatal?
Side effect.
Side effect. Okay. Yeah. The most fatal side effect of the stem cell, yeah, that have been reported, yeah, in the research is the cell become cancer. Yeah, the cell become tumor. Yeah, this is the most fatal. And actually, yeah, there are some report that it clumps. Yeah, in actually in intravenous. If we did it, we deliver the stem cell intravenously, there is possibility that the cell clump become thrombus, become emboli, and then it going through to our brain, vascular in brain, and it it makes the patient have a stroke. It's also very careful. Please be careful. Do not um, please do not tertarik ya easily interested in advertisement, in advertisement ya. This is stem cell clinic, stem cell therapy, stem cell this, stem cell what, and then they use stem cell injection, and then you not using without any protocol, without any previous examination, just intravenously deliver the stem cell, and then yeah, in a severe case, in a fatal case, the patient died. The patient died because of the emboli. So, if you want to have the stem cell treatment, if you want to have the stem cell treatment, yeah, if consultant, please go to the hospital. Go to hospital and then meet your expert. I want you to meet the specialist, yeah, maybe orthopedic surgeon or cardiologist and neurologist, yeah. Please do not meet that. Do not go to the stem cell clinic, yeah, because there is only a few stem cell clinic that have been approved by the ED, by the Ministry of Health. Yeah. So please do not termakan ya oleh by advertisement ya. Please don't be don't easily fooled by the advertisement, because treatment of the stem cell is very strict, um, very still in ongoing research. Yeah, the FDA, most of the treatment of the stem cell is still not FDA have not have FDA approved. Yeah, I think that if
Okay, and then we go to the question number 13. Yeah. How do you give secretome stem cell doses to COVID-19 patient with mild, moderate, and severe symptoms?
I'm sorry. How do you give secretome stem cell dose to COVID
Doses,
patient with
doses
mild,
to
moderate?
with mild, moderate, and severe symptoms.
Okay. Yes, the doses of the stem cell is vary, and we still in investigation that what is the optimal dose to treat the mild, to treat the severe symptom. Actually, in mild condition, we still not using stem cell in mild condition, but in the severe condition, the optimal doses is we still calculating. We still comparing the doses of the of stem cells in the COVID-19. So we still investigate the optimal dose to treat the patient, severe ill patient with the COVID-19. It's still in the progress. Okay, I think that's,
Okay, doc. And then, yeah. Can stem cell be used to cure viruses other than COVID-19, such as HIV, pest, etc.?
yeah. It is possible. Yeah, I think it is possible if you, because if we see the feature of the stem cell, yeah, it can treat almost all infection, all tumor, all defect, all the injury can be treated with the stem cell. So I said earlier that the stem cell is such an elixir, elixir to the every as a drug, as apa what we call it, the life the life potion. I said the life potion to the every disease. So it's still possible, but still need more research to treat the HIV. I think for the HIV, yeah, HIV, and then we already have antivirus, yeah, retroviral, antiretroviral. So I think we don't need stem cell. Just using an antiretroviral and the HIV can be cured.
Okay. Actually, I am afraid this will continue into the night. Okay, still have a question. Maybe slightly similar. Is there a possibility that the use of stem cell can cause side effect on the recipient's body? It is slightly
Okay.
similar.
Yeah, similar. I think. Still there is a possibility of the side effects such as a cancer. It can become cancer and rejection. Yeah, and etc. So our duty, yeah, as a researcher and the clinician, is to reduce it, to make sure that the stem cell treatment is free of side effect. Yeah.
Okay, thank you, Doc. And yeah, I hope it is the last. Bonnie Fascio. Bonnie, you can directly open
Yes,
your...
Ibu.
Yeah, okay, thank you.
So, hello, Ibu. Hello, Doc. Good evening. So, I am Bonifacio Buking Buagayan from Ilocos Sur Polytechnic State College, Philippines, second year, major in science. So, since you mentioned a while ago about spinal and osteoarthritis, and I guess it is related to spondylosis rather, Doc. It's just that one of my loved ones, sorry not to mention, it's just a matter of confidentiality. Female, 56 years old, a mother of four, farmer and a housekeeper, She was being diagnosed for having a spondylosis several months ago due to frequent pain to her back and hips and having a hard time to walk for a distance. And since she was too conservative and perhaps she's afraid to be exposed in hospital environment, she decided not to indulge medication. We tried to convince her, but sad to say she already decided. As a concerned family member, Doc, can I ask you a pieces of advice, Doc? If there would be other ways of treatments to this, except for, of course, drug medicine and surgeries, and are there herbal or body massage therapy could help to ease the pain and to weaken or treat the said disease, Doc? Thank you very much.
Okay. Yeah. Thank you for the question. Yeah. In spondylosis cases, yeah. Yeah. I think for the better, yeah. Before we treat the spondylosis, yeah, we have to do several examination. We have to do the several examination. We have, because there are many types, yeah, in our knowledge, yeah, in our study, that there are many types of spondylosis. We have to make sure that which type the spondylosis that happen in the patient. Um, Actually, there are type 1, type 2, type 3, type 4. If the type is indication for operation, if the type is indication for operation, please do not do any massage, yeah, to the patient. Please don't do not, because it will make the disease worsen. So you have to be very careful about this. And then if the spondylosis is still in, maybe in a type 1 or type 2, yeah, maybe we only need the doctor will only advise you to do the physiotherapy rehabilitation, yeah, the physiotherapy rehabilitation, and then medicine, it is a drug, yeah, and then based on the cause of the spondylosis, yeah, we have to find also the cause of the spondylitis. If the cause of the spondylosis is the from the bacteria or from the virus, so we have to treat the bacteria of the virus. We have to treat the disease. But if it's because of trauma, it depends on what kind of trauma and what the degree of the trauma. Because considering if there is a severe injury, maybe you need some more aggressive treatment, such as operation or surgery. Yeah, if it is a mild condition, maybe the doctor will advise you to have a rehabilitation protocol or and the pain relief to relieve the pain. So and for the herbal, I think
Yes, Doc.
yeah, so many herbal that provided, yeah, in advertisement, yeah, in apothecary, but uh, they are still in research, yeah. There are still no yeah, more of the herbal is the adjunct therapy. Is it, you have to also, we have to always remember this. Most of the research about the herbal is act as an adjunct therapy. Just not substitute therapy, but a complementary therapy. So you still need the drug, yeah, the chemical drug that provided by your doctors, and then you have to ask your doctor about the what kind of herbal that you may found, yeah. Such as maybe in our country, yeah, you may have a herbal such as bipolen, yeah, and then herbal such as maybe monacolin, yeah, monacolin is red yeast rice. Red yeast rice, it can reduce the inflammation, yeah. Red yeast rice, yeah, red yeast rice in Indonesia we call it beras angka. Beras angka, and it can reduce the cholesterol, it can reduce the inflammation, but yeah, you still that all of them is complementary therapy, not to substitute the first drug or the first therapy. Yeah, I think that's my opinion. Yeah, my advice for the cases. Thank you.
Thank you very much, Doc. But additional question, Doc.
Yes.
So meaning to say there's a big probability that if this will not treated properly, then it can cause death, Doc.
Ah, for that question, I cannot answer it because you have to. I have to see what is the specific condition it because by knowing the specific condition of the patient, so we can talk about the prognosis. So I have to make sure. I don't want to give you a good a good promise, or I don't want to give you a bad promise, but. Ya, as a doctor, uh, I think all the doctor, yeah, have to check it first, have to make sure the diagnosis, have to make sure the diagnosis of this, and then after that we can proceed to the treatment and then the prognosis. So I think you still have to see the orthopedic doctor.
Okay, thank you, Doctor. Thank you very much, Doc. Thank
Okay,
you.
you're welcome.
Okay, I hope Dr. Denny explanation can help and your loved ones get the best treatment for it. Okay.
Yes, Ibu. Thank you very much, Ibu.
Dear student, this is the end of the question and answer session. I think our discussion was very exciting, and if it is continuous, I won't be going home. Thanks to the audience that had participated actively, and then we have a photo session. So please open your camera, please. Dr. Denny, you can stop your sharing.
Okay, I will stop my sharing.
Okay.
Okay, thank you.
Okay. Please open your camera. And show your best smile. Okay, we still waiting for the other. Please, the other, open your camera. Okay, we have which one first? One, two, three. And then we have the second page. Okay. One, two, three. And the last page. Okay. One, two, three. Okay. Finally, we got to the last session in this event that is closing. We would like to say thanks again for Dr. Denny Adriansyah for your informative and interesting talk, and to audience for your active participation. And I hope what we had conducted today will be useful for us. dear student, and also Dr. Denny. If I made mistakes in guiding this event, I apologize. We are very happy to meet all of you. Have a nice day, and wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much,
Thank you
Ibu. Thank you,
very
Doc.
much, Dr. Denny, and all the students. Have a nice day all.